to order. So for the record, please know that Erin Kelly is representing Deputy Mayor Susan Miles Gustav, and Zahira McNatt is representing Dr. Michelle Morse, both in a voting capacity. Thank you. So before we proceed with the meeting, I would like to thank Jackie Rowe Adams for attending the Gotham Health Sydenham Community Advisory Board Annual Public Meeting on October 10th. And
Thank you, you're welcome.
thank you. And Gouverneur's 140th year anniversary celebration on October
Thank you, you're welcome.
again.
Anytime.
And I would also like to thank Frida Wang and Dr. Tony Esaline and Vanessa Rodriguez for their site visit to Lincoln Hospital, October 23rd. Thank
Say
you.
Thank you.
Thank you, and you're welcome.
And lastly,
We enjoyed it. Yes.
I would like to thank Anita Kawatra and Jackie Rowe Adams
Yes.
for attending the NYC Health and Hospitals Philanthropy event on October 23rd.
Thank you.
Frida was there
Yeah,
too.
she was there too. So we
Thank
all
you.
got to say, we all have to say it together. Thank you, you're
You're
welcome.
Thank you. Okay, so next on the agenda is the adoption of the minutes for the Board of Directors meeting held on September 25th, 2025. Are there any questions, comments, or changes? Hearing none, can I hear a motion to accept the minutes? All in favor, please say yes.
Yes.
Opposed, say no. So the motion carries. The minutes are adopted. During the executive session, the board received and approved NYC Health and Hospitals medical staff credentialing, initial appointments, reappointments, and changes of privileges for the month of October 2025. The board received and approved oral and written governing body report from NYC Health and Hospitals South Brooklyn Health. The board received and approved semi-annual governing body 2024 performance improvement and evaluation plan written submission from NYC Health and Hospitals Sydenham, Gotham Health Center. And we also received and approved the written submission of the semi-annual governing body reports from NYC Health and Hospitals Kings County. So let me move on to Vendex approvals. Since we began the process of approving contracts prior to Vendex approvals, there are 9 items on today's agenda requiring Vendex approval, 5 of which have that approval. There are 21 items from previous board meetings pending Vendex approval. So we will continue to notify the board as outstanding Vendex approvals are received. So we're gonna move now to the resolutions. So it would be item number 6. So authorizing the executive director of MetroPlus Health Plan, Inc. to execute contracts with Health Plan Services, Inc., a business process as a service solution for the Medicare exchange lines of business for a total not to exceed amount of $30 million, including a 20% contingency for a 5-year term. This was presented to the MetroPlus Board of Directors on 9/25/2025.
Hi, good afternoon. MetroPlus is seeking to contract with a vendor. Ganesh Ramerton, CIO here at MetroPlus.
Steve Stankishman, Chief Counsel at MetroPlus.
Okay. MetroPlus is seeking to contract with a vendor to outsource operational and technical services, including enrollment and eligibility, claims processing, premium billing, payment reconciliation, coordination of benefits, regulatory and compliance adherence and updates, and technology, including EDI connectivity, integration with vendor partners, as well as hosting and software. Next slide. MetroPlus has outsourced BPO services for Medicare since 2008 and added QHP services in 2014 to SS&C. We require a new vendor as we move to our new HealthEdge core platform, and our current vendor will no longer be able to deliver the services on our new platform. The current BPO contract expires on 12/31/26. Due to the specific nature of the requirements, only a limited number of vendors were available to provide these types of services. Instead of doing a full RFP, MetroPlus elected to conduct a negotiated acquisition, which is a procurement methodology used when there are a limited number of potential candidate vendors available to meet the needs without us needing to do and conduct a protracted RFP process. MetroPlus is seeking authorization to execute a 5-year agreement with Wipro in the amount of $30 million, including 20% contingency for these BPaaS services. Wipro will provide a solution that will allow MetroPlus to outsource key operational and technological processes for our Medicare and QHP lines of business. As of mid-October, MetroPlus has 13,000 Medicare members and 10,000 QHP members, and we process almost 500,000 claims annually. WIPPRO will integrate into our new HealthEdge core processing platform. The contract term will include an initial implementation term of 1 year, followed by 4 years of operational term. To avoid disruption in services, WIPPRO will begin implementation while we overlap with our existing BPO vendor, which is slated to end on December 31st of 26. On the next slide is our typical negotiated acquisition and RFP criteria. These were the timelines of the procurement process. And WIPPRO has committed to a 30% MWBE utilization plan and will be working with IT Resource Solution, NET, a New York City, New York State MWBE company for implementation and configuration staffing. To summarize, we are seeking authority to enter into contract with WIPPRO for BPaaS services in the amount of $30 million, including a 20% contingency for a 5-year term. Happy to take any questions.
Thank you. Any questions from board members? Okay, so let's take it up for the vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Thank you very much.
I'm going to move to item number 7 on your agenda. And it's authorizing the New York City Health and Hospitals Corporation, the system, to execute contracts with third-party reimbursement solutions, LLC, Forbes Mazars, LLP, Baker Tilly Advisory Group LP, formerly Moss Adams, and Manat Health Strategies LLC for Medicare and Medicaid reimbursement consulting services at a not-to-exceed amount of $10,800,000, which includes a 20% contingency for a contract term of 3 years and 2 one-year renewal options exercisable at the discretion of the system. And this was presented to the Finance Committee on October 14th, 2025.
Good afternoon. I'm Linda DeHart, Vice President in the Finance Department. For background on these services, Medicaid and Medicare reimbursement consulting services are essential services used by healthcare systems to ensure compliance with complex and often changing regulations regarding Medicaid and Medicare reimbursement and reporting. Timely and accurate reporting submissions are required to avoid penalties and to secure proper reimbursement for the system. Consultants in this space assist the system in optimizing available reimbursement rates and settlements, and of particular importance to health and hospitals, provide advice and assistance regarding supplemental funding streams available to the system. This RFP consolidated several previously solicited, separately solicited scopes of work, including services that had been contracted directly by the reimbursement department, as well as services that were obtained through other departments' vendor arrangements. Scopes included in the RFP included under the umbrella of Medicare reimbursement and reporting, general Medicare reimbursement analysis and cost report support, Medicare appeal support, Medicare DISH and uncompensated care policy and reporting support. Under the umbrella of Medicaid and state reporting, it included general New York State Medicaid reimbursement, rate analysis and appeal support, particular long-term care reimbursement support, supplemental Medicaid funding and innovative payment policy model support, and consolidated fiscal reporting system submission support. For a little history on our use of these services, the reimbursement department, as I noted previously, entered into 2 agreements for Medicare-related consulting services. That included an agreement with third-party reimbursement for Medicare general reimbursement and cost reporting support that was initially awarded via an RFP for a term running from November 2019 through November 2024 and had a not-to-exceed amount of $2 million. There were subsequent amendments that both expanded the scope to include additional resources and extended the contract expiration date to December 31st, 2025, with the final total contract value of just under $4.1 million. There was also a contract with Moss Adams, which has now been acquired by Baker Tilly, for Medicare DISH and uncompensated care consulting services. That was also awarded via RFP with an initial term running from November 2019 through November 2024 and had a not-to-exceed amount of $2.2 million. Subsequent amendments to that contract resulted in a final contract expiration date of December 31st, 2025, and total not-to-exceed value of $2.7 million. So for those two combined contracts, the NTE together was $6.8 million, and spend to date on those contracts has been just under $6.1 million. Additionally, the department has accessed other services through other departments' contracts, as I mentioned. So $2.8 million roughly has been spent on Medicaid supplemental payment support and CFR consulting services using Manatt Health Strategies and Forvis Mazars. On the next page, we have our RFP criteria and an overview of our procurement timeline, which started in January and ended in June of this year. As a result of the RFP, we selected 4 vendors that were the top scorers across all subscopes of work. Subject to negotiation, we anticipate assigning each vendor primary scopes of work, but will also provide flexibility to the system to utilize them in other areas of their expertise as needed. So the 4 vendors and their primary scopes are third-party reimbursement, focused on Medicare general reimbursement and cost reporting, as well as Medicare appeal support. Moss Adams, which again was acquired by Baker Tilly, focusing on Medicare DISH and uncompensated care and Medicare DISH appeals. Forvis Mazars, focusing on Medicaid general reimbursement, long-term care reimbursement, and CFR reporting to the state. And Manatt Health Strategies, focusing on Medicaid supplemental funding and innovative payment and policy models. So these were all, as noted, current vendors, and they all have had excellent performance evaluations. The vendor diversity target for the solicitation was 10%, which Forvis Mazars met through a subcontract using healthcare management solutions. The other 3 vendors were granted waivers based on self-performance of the entire scopes of work. So I'm happy to take any questions from the board.
Thank you. Any questions from board members? Okay, so let me take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much. Let's move to number 8. Read that one. You want to read it?
Number 8, authorizing New York City Health and Hospitals Corporation system to increase the funding by $10,896,459 for its previously executed agreements with each of Institute for Community Living, Inc., ICL, and Communilife, Inc., Communilife, for the provision of medical respite beds and services, such that the funding is increased from $17,960,500 to $28,856,959, thereby funding the increasing capacity of the program from 51 beds to 75 beds. This was presented and discussed at Finance Committee on October 14th, 2025, and approved to bring forward to the board.
Good afternoon. I'm here with my colleague, Dr. Jonathan Meldrum, the Medical Director of Housing for Health. We're here to brief you on the contract adjustment to the Medical Respite Program, which is an essential part of Housing for Health. You've seen this slide before as we speak to the system's Housing for Health initiative, which is a program that connects our patients experiencing homelessness to housing supports and opportunities in order to stabilize their lives and improve their health. These patients are medically and socially complex, and Housing for Health provides an access point for housing from the healthcare system. Next slide, please. Patients experiencing homelessness have long and complex inpatient stays, and even when medically cleared for discharge, have no safe place to go to recover and heal, and shelter is not an option. Yet after a hospital stay, patients experiencing homelessness are more vulnerable. Medical respite is one solution. It offers a safe space in the community with access to home-based clinical services, is one of the system's initiatives focused on reduction of length of stay. Today, we contract with 2 vendors who have grown involved with us to meet the needs of our patients. Medical respite serves approximately 400 patients per year. Next slide, please. Medical respite offers significant benefits to the system and our patients. For the system, it reduces inpatient length of stay who no longer require hospitalization in a cost-efficient way. It also improves access to hospital beds for new admissions, allowing the system to generate revenue. Based on our conservative estimates, the annual projected net revenue meets the program's operating costs. Next slide, please. We've also seen positive patient outcomes after respite. We have looked at the utilization data of a small cohort of patients using our EMR. We've seen a reduction in the utilization of the emergency department, reduction in the number of med-surg days, and a reduction in inpatient psych days. We've also seen an increase in outpatient visits. Medical respite has also been a great launch point into stable housing. We are in the process of evaluating the cost savings associated with our housing programs for risk-attributed patients as well. Slide. In 2024, we had a 4-week long wait list for respite. This converged with a high census at our hospitals as well as sicker patients. Patients were waiting to discharge from the hospital to respite, lengthening their hospital stay. We saw a significant impact of the Beth Israel closure on Bellevue. We had an opportunity to expand the program and add more services to meet the system demand and patient acuity. We added more beds and expedited the spending in the existing contracts. In order to continue to the remaining 2 years of the existing contract at 75 bed, the program needs an additional $10.8 million. I'll pause now for questions.
Any questions from board members on this one?
No, other than, I think we talked about at Finance Committee, just the great results that we've seen from the respite and how that's impacted not just our care and outcomes, but also financially. So keeping track of that as well and reporting on that would be great for us. We'd love to keep caring about the good work you're doing.
Thanks, Rita.
Great work. Okay, so let me take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much. I'm going to move now to number 9, authorizing the New York City Health and Hospitals Corporation to execute a contract with CDE Air Conditioning Co., Inc. to undertake a boiler and building management system upgrade project of NYC Health and Hospitals North Central Bronx Hospital for a contract amount of $8,781,032 with a 10% project contingency of $878,103 to bring the total cost not to exceed $9,659,135. And this is being presented directly to the board today.
Good afternoon, board members, Dr. Pagan and Dr. Katz. I'm Manny Saez from the Office of Facilities Development. A little bit of background relative to this ask. North Central Bronx is currently operating 5 boilers that serve the facility with steam, heating and sterilization, and hot water. One of the boilers previously was completely taken out of service and needs full refurbishment. Burners and controls for 4 of the 5 boilers are beyond their useful life and need an upgrade, and the existing facility needs a centralized BMS or building management system to efficiently operate and maintain critical MEP systems throughout the building. The construction scope will include new burners and controls for boilers 1, 3, 4, and 5, refurbishment for boiler 4, a new burner management system, and a new building-wide building management system that would include additional mechanical equipment, including chillers, pumps, and fans. Boiler will be phased to ensure minimal impact on the facility's steam, and there will be no impact to patient care. Expected to begin in the fall of 2025 and be for the duration of 18 months. That will be at the end of the spring of 2027. 1 boiler will be out of service during the heating season, but there is sufficient capacity to hold the load in the facility. Here is a timeline of the procurement. Next slide, please. And here is the construction contract. So procurement, it was publicly sourced. Construction amount, contract amount is $8.7 million. CDE and Air Conditioning is the mechanical HVAC vendor. They have 4 excellent, 7 good, and 4 satisfactory. Construction expected to begin in the fall and end at the end of spring 2027. As I previously mentioned, they have met the 30% MWBE goal, and there are a list of the vendors listed in that chart. Here is the project budget for $8.7 million with a contingency of a little over $800,000 for a total contract amount of $9,659,135. Happy to take any questions.
Any questions? Okay. All in favor, please say yes.
Yes.
Opposed, say no. Resolution.
Thank you.
Thank you. So I'm going to move now to number 10, amending previously adopted resolution previously adopted resolution by the Board of Directors of New York City Health and Hospitals Corporation on November 18, 2021, authorizing the system to lease from an entity named as Coney Island Associates Retail 2 LLC in a to-be-constructed building at 1607 Surf Avenue between West 17th and 16th Streets, approximately 2,500 square feet at a yearly rent of $30 per square foot, to be escalated by 10% every 5 years plus a share of increases in developers' operating costs to house the Ida G. Israel Community Health Clinic, with such amendment correcting an error in the name of the landlord to correct such name in such resolution to be Coney Island Associates 2 Retail LLC. And this was presented directly to the board. This is being presented directly to the Board of Directors today.
I think the second one.
Second one also. So, and also amending previously adopted resolution by the Board of Directors of New York City Health and Hospitals Corporation on March 28, 2024, authorizing the system to lease for from a name as Coney Island Associates Retail 2 LLC in a to-be-constructed building at 2932 West 16th Street between West 17th and 16th Streets, approximately 6,250 square feet, for a yearly rent of $25 per square foot to be escalated by 10% after 5 years, plus the provision of 10 parking spaces charged at $150 per month for each parking space, and provided further that the system shall hold 2 5-year options to renew the lease with the rent during the first renewal term to be at the higher of 95% of fair market value or 10% over the prior rent, and with the rent for the second renewal term to be at a 10% increase over the prior rent, with the rent over the entire potential 20-year term totaling approximately $3,185,781 to house the Ida G. Israel Community Chemical Dependency Clinic, with such amendment correcting an error in the name of the landlord to correct such name in such resolution to be Coney Island Associates 2 Retail LLC.
Thank you.
Also being presented directly to the board. Yes.
Then an administrative correction, the board authorized 2 leases on behalf of South Brooklyn Health in 2021 and 2024, and the landlord entity name will change from Coney Island Associates Retail 2 LLC to Coney Island Associates 2 Retail LLC.
Okay, thank you.
You're welcome.
Okay, any questions from board members? Let me vote on the first one, on number 10. All in favor, please say yes.
Yes.
Opposed, say no. And on number 11, all in favor, please say yes.
Yes.
Opposed, say no. So the both resolutions approved. Let me move to number 12, amending the resolution adopted by the Board of Directors of New York City Health and Hospitals Corporation on May 29, 2025, authorizing the execution of a contract with Johnson Controls, Inc. To provide building management system preventative maintenance and repair services at various NYC Health and Hospitals facilities, with such amendment increasing the contract term from 3 years with 2 one-year options to 5 years with no renewal options at the previously approved not to exceed amount of $12,676,916, including a 10% contingency of $548,793.41. This is being presented directly to the board today. Manny?
Good afternoon once again. We're requesting this amendment to move from 3 base years to 5 years because we have been able to achieve a 6% production in savings with JCI as a result of being able to do so. The average savings would be over $144,000 a year, and potentially subsequent for the following years, considering if we don't have any other major needs for service items beyond the contract. And that is basically it. Sorry.
Any questions? Okay, hearing none, then let's take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved, so.
Thank you.
Thank you. I'm gonna move on to the last one, 13. Adopting in the name of the New York City Health and Hospitals Corporation, Board of Directors and Implementation Strategy Plan, prepared for each of NYC Health and Hospitals' 10 acute care hospitals over 11 campuses for the NYC Health and Hospitals Henry J. Carter Specialty Hospital as a supplement to the Community Health Needs Assessment, which was approved by the Board of Directors in June 2025. And this being presented directly to the board.
Good afternoon, everyone. I'm Deborah Brown, Senior Vice President and Chief External Affairs Officer. It is a pleasure to be here today, and I am turning the mic over to my colleague who will be doing the presentation.
Thanks, Deb. Hello, everybody. My name is Okenfe Liberty, Assistant Vice President, Government Community Affairs. I wanted to quickly thank a bunch of our team members that also helped in working on this on this report. It's been over a year in the making, almost a year and a half. We are essentially at the last leg right now. So one of them is actually here, Elizana, but the others, I guess, watching online.
Not getting wet.
So for the 2025 CHNA, as most of you know, we engaged with stakeholders across the 5 boroughs through our 21 Community Advisory Board, CBO partners. We hosted borough-wide forums. We interviewed our CEOs, SVPs, and of course, system leaders to essentially understand the needs of the community that we serve. So what you see on the left, the needs on the left side would display the health services that the community was essentially really concerned about throughout the process. And then, of course, the one on the right shows what the communities also wanted us to address. We do have understanding that addressing these challenges is going to require collaboration amongst partners across all sectors, as many of these barriers extend beyond the reach of healthcare alone. So for us, we believe that the ISP is going to translate these findings into action, showcasing programs and initiatives to connect primary care, preventive care, specialty, and of course, behavioral health care to communities that we serve. Next slide. So, next slide, one more slide. All right. So one of the things that we wanted to do differently, from when this whole process started in 2016 to 2022, and of course now 2025, was how do we marry what we've heard from the community, what the community has said, what we heard from our CEOs, what we've written in the report, and then how do we marry that with the strategic pillars of the health system, and of course, how do we also sync that with the goals of the health system. These are tall orders, but we wanted to figure out that this is something that we can do, and this is what the ISP is showing to us. So in one of the health system's goals, which is to improve diabetes and hypertension control for patients experiencing homelessness, this was something that we heard a lot about in the community with patients experiencing homelessness and having high risk of uncontrolled diabetes. And of course, there are also high utilizer of our Medicaid, of our emergency room visits for inpatient stay. And so we wanted to highlight what are some of those programs that we have in the health system that is going to help us address this. So we wanted to spotlight the integrating housing and chronic disease care at Harlem Hospital. They have a program with the community health workers that are doing a wonderful job where they're able to track some of the patients with uncontrolled diabetes and hypertension that have potentially lost contact with their care team. And the CHW, they're able to conduct proactive outreach. They find the patients, they connect them with their primary care provider, they do follow-up on visits. There's a whole wrap-around services that they are doing, and that goes really into the interest of what the communities were really concerned with in terms of the homelessness that they felt that they are experiencing, and then at the health system, how do we address that? So this is one of the programs that's helping us address that. And then, of course, we also have a success measure. How we're going to monitor the metrics of the diabetics. We're in contact with the team, and how we're going to monitor the number of emergency room visits in terms of how does that actually translate. And so we have others there. Next slide. So another program I wanted to spotlight was the lifestyle medicine program. Again, chronic disease management is something that the community mentioned, and they also wanted us to help figure that out. How can we approach that? And so we felt that highlighting the lifestyle medicine program that we have, which is essentially across all the 5 boroughs now, is something that is really, really important. And as you can see, they provided over 10,000 group visits and served over 1,300 patients in the past year. And of course, nobody really says no to free food. Distributed over 5,000 boxes of free fresh produce since the launch in February 2024. Next slide. So another goal of the health system was how do we make health and hospitals a friendlier place to get care? For a lot of you that come to the CRC meeting, when we tend to think of, hey, what are the issues concerning the community? In terms of attitude of some of our staff, how they treat people when they walk into our doors. That is something that we also wanted to approach. That immediately a patient comes to any of our facility, before they even get the health care that they come for, the individual that they are seeing at first, what is that interpersonal relationship, right? How are they being approached? What are the concerns that are being raised, and then how do we address those things? And one of the program that, in addition to I Care for Kindness and all that stuff, but one of the things I wanted to spotlight was the language assistance that's been offered across our health system in more than 300 languages. So we don't want to have a situation whereby if someone doesn't really speak English, then they can have access to the care that they deserve. All that is taken care of. And then, of course, we have the success measure in terms of how that is going to work. Next slide. And so another goal of the health system was MetroPlus, and in terms of our patient satisfaction and our work with MetroPlus, Dr. Kais, is always mentioning that, hey, folks need to register for MetroPlus. And then, of course, how do we get our patient satisfaction as well? So we believe that with MyChart and how our patients are utilizing MyChart, in addition to the number of registration that we're having with MetroPlus, that is definitely going to improve this partnership between provider and the and the patient. Next slide. Another goal was increase full-time permanent job opportunity for nurses. For all of you that came to our annual public meetings, with the nurses and the protest and non-protest, that is something that we also took into consideration and wanted to figure out how do we also address this issue. We love our nurses, and we really love the kind of care that they are providing to our patients. And so, when you look at the nurse residency program and the wonderful job that is doing, the program has already enrolled over 1,486 participants. The program, of course, has been expanded throughout the healthcare, the post-acute, Gotham sites, and correctional health services. Hopefully next year we're not going to get any nurse protest. Next slide. And the other priority health needs for 2025 was bridging health gap. And so we looked at, okay, what are some of the system goals that falls under this? Upgrade the infrastructure and medical equipment to make our health system more resilient, secure, and sustainable. There are capital projects that are going on all through our health system, but we wanted to spotlight, some of the good ones. Well, they're all good, but we want to spotlight at least one that is happening at Kings County Hospital in terms of the capital upgrades that they are currently engaged in. Next slide. And next slide, I'm just going to skip because this slide is a lot. The other thing that I wanted to mention was another goal was to house 3,000 patients. Housing was something throughout this whole community engagement process of the CHNA. When we met with the community members, when we had the board-wide meetings, when we met with some of the community board members, everyone kept on talking about housing and housing and housing. And so for us, we wanted to also spotlight the Bridge to Home project, which is a partnership with the Mayor Adams administration that was launched. And so that's also another good thing that is coming out of that. Next slide. Another goal of the health system was to build pathways to careers in medicine for students to reflect the communities and cultures of our patients to enhance. Again, why is this important? We all know that the strength of our health system is the care and the belief that we have in a diverse staff. And so we wanted to spotlight the medical opportunities for health and aspiring, inclusive, clinicians. The Mosaic program is a fantastic program, and that it's something that we are, of course, paying attention to. Next slide. So, as we do all this, what are the resource commitments from the health system? How do we evaluate a lot of the things that we are mentioning here? One, we believe that the health system, of course, under the leadership of Dr. Katz, is going to continue the financial and in-kind resources and commitment for the next 3 years. And some of these resources include clinical and non-clinical services, evaluation efforts, and our ongoing community partnership, the innovative approaches that we have with staff. Also, more importantly, is the evaluation part. It's a lot of programs, more than 200 programs throughout the health system that we are looking at. But again, how do we do an evaluation of some of those programs, especially the ones that we spotlighted, that we based on qualitative metrics, qualitative feedback, and of course, working with our community partners. The information sharing, of course, is going to remain ongoing, and our hope is that I want to come back at some point and work with the board to figure out how we can give you an update on some of the programs and the metrics and the feedback and everything that we are doing from the CHNA itself to how we're actually implementing the ISP. I think one of the beautiful things about this ISP is the fact that it includes all of our facilities, including Gotham Health and the separate work that we did with them. So, this is an inclusive effort, and it's going to continue being an inclusive effort that will continue to work with everybody.
Well done. Yes. Any questions from board members?
No, but we really appreciate it's such a great
Yeah.
compendium of
it's good.
everything that we're doing.
So I have a question. Yeah, but first of all, very good presentation. And it's something different, and I think it'll work. But my question becomes, with the partners, are they all on board with this? Or
Yes, the partners are all on board with them. A lot of them are also looking to us that, hey, reach out to us, how can we be helpful? Even prior to this, one of the things that we've done was to create our weekly digest, where we essentially talk to let folks know about all the things and events and programs that are happening within the health system. We share it out to folks on a weekly basis, and then there are questions or room for additional partnership, they'll reach out to us. We'll work with them.
And one of the things we hear through this process is like, don't just do this once and then walk away, and then we're not going to see you from 3 years from now. And so that's, is something, we started the digest 4 years ago, 5 years ago. Yeah. We do that. We take lots of opportunities to have very, very warm touches with our community partners. So we're not just showing up for the CHNA and the ISP like, hey, we're here again.
And just to add to that, I think, well, we probably didn't know going into this whole thing, but that we realize now that a lot of people, other companies, other local and state and federal agencies are using our ISP for their own things, for their own reports. And, so that goes to show in terms of the amount of work that we put in there, that we put into this report, and taking it extremely seriously, because we never know where it's going to land.
that's right. Thank you.
Thank you. I just want to say that I'm so proud of all the work that went into this. I know this was a lot of work, and I know it has grown over time. And you've done you have all done what is your staff is here? You should just,
Representational staff.
I mean, this is a lot of work, and I'll be hard pressed to find a report that is better done than this one. If you find it, let me know.
Nope.
But I think this year that the fact that you have these success measures that you may meet some, but at least it makes you think about like goals and setting goals, and thank you everyone that participated on this, because this was a collective effort. Any other comments or questions? Okay, so let's vote on the resolution. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much.
Thank you.
Thank you.
Okay, President's report.
Thank you. Lots of great things going on. I'm not going to attempt to read them all. I will tell you some of my favorite hits. So there are 1,200 skilled nursing facilities in the state of New York. Who has the second, third, fourth, 10th, and 11th highest ranking facilities? The answer is us. And those are all our facilities. We got 5. All 5 are in the top 11. There are 1,200 facilities in the state of New York, right? I mean, that is pretty amazing. And for anyone who believes that the public sector cannot perform, I think that's pretty impressive evidence that yes, we can. It's a small event, but it says so much more that Natalia Sineas every year celebrates the nurses who become doctoral nurses. This year, 16 of them were newly admitted into her doctoral circle, which has over 100 of our own nurses. And I like it because it's just one of the many ways that she's made nursing more professionalized, encourage people to get additional training, really focuses on nursing practice. I think it has made a huge difference. We celebrated the 140-year history of Gouverneur, and there was someone had found a New York Times article announcing the opening of Gouverneur, and my favorite part was what they highlighted as the major innovation was it had an elevator. It was a new facility with an elevator. 140 years ago, that was a major thing, a hospital with an elevator. So that was very nice. Wendy Wilcox made us all proud in presenting with Mayor Adams the New York City baby boxes, which are going to our newest New Yorkers, all the supplies that parents would need in order to make things a success. Queens discharged the miraculous baby that the parents called Miracle with a Y, who was born at 22 weeks. And again, just to give you some perspective, when I was a resident, 28 weeks was the limit of viability. If a baby was born before 28 weeks, you put the baby in a blanket and on the mother and said a prayer, and nobody tried to do anything for someone 28. That was the limit. 28 to 32, you still worried a tremendous amount. Being able to discharge a baby born at 22 weeks, phenomenal. Phenomenal, and the baby is growing and developing.
Wow. How much did the baby weigh?
The baby weighed 1 pound, 0.6 ounces. Right, I mean, that's, right, that's this, right? It fit in your hand, right? And the family was incredibly grateful for the amazing care that they got at Queens Hospital.
Is that a record or?
No, but it's pretty amazing that it happened at a community hospital.
Which I think it said that they chose to go to Queens, right?
Yes,
Yeah.
that was their wish. We have lots of patients who choose to come to us because we do well. While we're on the NICU, we started a new literacy program for families where there is a baby in the NICU, and some people might say, well, but the baby can't understand what you're reading, but that's not the point. The point is to give another pleasurable way for parents to communicate with newborns and to normalize what can be an extremely difficult experience. We participated in a variety of breast cancer awareness events. If you haven't yet gone to see our Bridge to Home, I think you'll be incredibly proud of it. It's going really well. We admit additional residents every week, and we think that, you know, this is a model we want to promote going forward, that New York City spends a lot of money on shelter, And that's a wonderful thing that nobody has to sleep outside. But for people with serious mental illness and substance use, we think it would be a better investment for the city to spend it on treatment in shelter-like places. In other words, so not the licensed hospital, which would be too expensive. If you have a chance, Ted Long would be his usual incredibly enthusiastic self to have you come and see it. Okay, I think that those are the major hits. I'll allow you to read it on your own to see the additional things. But of course, always happy to hear your thoughts about health and hospitals and answer any questions if there are any.
Okay, any questions? Okay, so thank you, Dr. Katz.
Thank
So the committee and subsidiary reports were emailed to you and are in your electronic folders for your review and submission into the record. Are there any questions or comments about the reports? No. Is there any old or new business from board members to come before this board? So hearing none, the board meeting is adjourned.
Thank you.
This meeting is no longer being